Thank you for joining us for this episode of the Boondoggle Tapes. The following is Jorge Torres' autopsy, conducted on February 25, 2020 at 9 a.m. With the help of internet research, we will provide a quick explanation of what these medical terms mean and how they are relevant to Jorge Torres' death. We are not medically trained and have relied on AI to help us discern the meaning of this autopsy's findings. Our interpretation of this autopsy report should be read with this in mind. The following report is graphic and should be viewed by a mature audience. Viewer discretion is advised. Final anatomical diagnosis. Jorge Torres died from positional asphyxia and environmental suffocation, meaning he was trapped in a confined space, a suitcase, and could not get enough oxygen to survive. The report emphasizes that he was confined for a prolonged period, which is consistent with a fatal lack of breathable air. It also documents blunt force injuries to the torso and head, including bruising to the skin and muscles, abrasions, swelling and bruising around the left eye, and bleeding beneath the scalp. These injuries show that he was subjected to significant physical trauma prior to death. While the injuries themselves are not listed as the direct cause of death, they indicate that violence occurred and likely contributed to his inability to escape or protect himself. Taken together, this section supports the conclusion that his death was caused by suffocation while confined, with clear evidence that he suffered physical assault. Toxicology section. The toxicology report confirms that Jorge Torres had alcohol in his system at the time of death. His blood ethanol level was measured at 0.138%, and the vitreous eye fluid ethanol level was measured at 0.213%. Differences between blood and vitreous levels are common in post-mortem testing, and the vitreous measurement is often considered more stable and reliable. Aside from alcohol, the only substances detected were caffeine and nicotine, which are not medically significant in determining cause of death. The screening found no other drugs, sedatives, narcotics, or intoxicants. In plain terms, this section indicates that he was intoxicated by alcohol, but no other drugs were present that would explain or directly cause his death. General statement. This section describes the physical condition of the body at the time of the autopsy. It explains that rigor mortis, the natural stiffening of muscles after death, had already receded, meaning the body had been deceased long enough for that phase to pass. It also notes fixed livor mortis, which is the purplish-red discoloration that occurs when blood settles after death. Because the lividity was fixed, it indicates that the body remained in the same position for a significant period of time after death. This section is not describing injuries. Rather, it provides forensic timing and confirms the post-mortem condition of the body. External examination. This portion of the report documents the general appearance of the body and any visible external injuries. It notes small areas of hemorrhage, bleeding, on the whites of the eyes, which can occur from pressure or trauma and are sometimes associated with asphyxial deaths. It also describes recent injuries to the lips and scalp, as well as blood-streaked mucus in the mouth, which can be consistent with trauma or stress around the time of death. Overall, this section confirms that Jorge Torres had multiple external injuries, particularly to the face and head, but no anatomical abnormalities unrelated to trauma. Blunt impact injuries, face and neck. This section describes clear evidence of blunt force trauma. It notes significant bruising and swelling of the left upper eyelid, indicating a forceful blow to the eye. Bruises and lacerations inside the lower lip, consistent with impact to the mouth. Bleeding beneath the scalp on the left side of the head, which confirms a substantial blow to the head. Abrasions on the right side of the face and neck, suggesting contact with a rough surface or object. Taken together, these injuries indicate that Jorge was struck multiple times in the head and face. These are consistent with assault-related trauma rather than accidental injury, This section documents significant trauma to George's back. It describes several long diagonal abrasions across the upper back, showing that his back was scraped forcefully against a rough surface. Clusters of deep purple and blue bruises on the left side of the back, extending into the underlying muscle tissue, which indicates strong, repeated impacts. A large bruise at the base of the spine, sacral region, suggesting a forceful blow to the lower back. In summary, this section shows severe blunt force trauma to the back, consistent with violent impact or dragging, not minor or accidental contact. This portion identifies trauma to both hands and arms. It notes bruising on the top of the left hand and the base of the right thumb, indicating that both hands sustained impact injuries. A dry abrasion near the right elbow, suggesting the arm was pressed or rubbed against a hard surface. 2 vertical abrasions on the left arm, consistent with scraping contact. These injuries are consistent with defensive wounds, meaning George likely raised his hands or arms to protect himself during the assault. Internal examination. This section states that there was no internal bleeding or trauma beneath the skin of the chest or abdomen. The internal body cavities were normal, with no abnormal fluid accumulation or decomposition. The pneumothorax test, which checks for air leakage from lung or chest trauma, was negative, meaning there were no penetrating or collapsing chest injuries. Overall, this section confirms that while there were external injuries, there was no hidden internal trauma to the chest or abdominal organs. Cardiovascular system. This section explains that George's major blood vessels were generally normal, with no blood clots in the veins or the pulmonary arteries. However, the report identifies a severe atherosclerotic blockage, greater than 75%, in the left anterior descending, LAD coronary artery, which is one of the heart's main blood supply vessels. This is a significant abnormality and indicates advanced heart disease, which can increase the risk of sudden cardiac death. That said, the report does not identify any acute heart damage, such as a recent heart attack. In plain language, George had serious underlying heart disease, but this was not listed as the direct cause of his death. Respiratory system. This section indicates that the airways were open and contained a small amount of froth, which is a common finding in deaths involving oxygen deprivation or cardiac arrest. The lungs were heavy and showed black carbon pigment and tobacco staining, which are consistent with long-term cigarette smoking. There was no evidence of blood clots or structural lung injury. In summary, this shows chronic lung damage from smoking, but no acute abnormality that independently explains death. Hepatobiliary system. This section reports that the liver, gallbladder, bile ducts, and pancreas are normal in structure and appearance. The liver is noted as congested, which is a common post-mortem finding and not considered abnormal disease. There are no findings here that contributed to his death. Reticuloendothelial system. The spleen and lymphatic organs appear normal for age. No enlargement or disease is noted. The thymus shows typical age-related fat replacement. There are no abnormalities in this section relevant to cause of death. Genitourinary system. The kidneys, bladder, prostate, and reproductive organs are all normal in appearance and structure. No signs of disease or injury are present. This section indicates no abnormalities relevant to his death. Endocrine system. The pituitary, adrenal, and thyroid glands are all normal. No abnormalities were found that would contribute to death. Neck. This section confirms there were no fractures, hemorrhages, or signs of trauma to the structures of the neck. There is no evidence of strangulation or airway compression. This finding rules out neck compression as a cause of death. Head. This section indicates that while there were external injuries to the scalp, the skull and brain show no fractures, bleeding, or structural abnormalities. The brain is normal in weight and appearance. There was no fatal brain injury, and the head trauma documented was not the cause of death. Musculoskeletal system. This section reports that there are no fractures or skeletal injuries to the major bones of the body. The muscles are normally developed. This means that there was no major skeletal trauma contributing to death. Thank you for watching this episode of the Boondoggle Tapes here on the Third Rail. Please join us on our Patreon channel at the link in the description for deeper insight and exclusive content. Until next time, please stay safe and take care of one another.